Hi guys, welcome back to Relentless. Today we're going to talk about proper sleeping positions. So proper sleeping positions. Everyone has a sleeping position that they love, but your sleeping position is either helping you or it is hindering you. So if you have a chronic pain that you're dealing with, how you sleep is either going to help you heal quicker or it is going to keep that problem around a lot longer and perhaps even make it worse. So before we get into a demo of how you should sleep, and I'll give you some tips and tricks onto how to modify some of the sleeping patterns that you have that you just can't get away from, before we go there, I want to remind you what proper posture looks like. So when we are properly aligned, when our anatomy is in all the right places, your ear is over your shoulder, which is over your hip, which is over your knee, which is over your ankle. So if you watched the last video we did about banker's back, we know that's not good. We know when we sit at our desk and we look like this, it can even get worse. But we do always bring our head back up because we want to look at the computer. So we know this is not good. So keep this in mind as we go through the demo of sleeping positions that could make this all worse and probably looks a lot like this. So remember, this is where we want to be, and if anything takes us out of this alignment on a chronic basis as a habit, it is only making anything you already have worse. So let's take a look at what some sleeping patterns you may have that will try to tweak a little bit and make better as a better outcome for you long term. So the first sleeping pattern we're going to break down is probably the favorite of many of you. But I promise you, I can help you train your body to sleep in a better position. So obviously we're looking at the face down stomach sleepers. The first problem I have with this is obviously the neck. So if you are a stomach sleeper, you know that you have one favorite side that you're going to turn your neck to. It just doesn't feel as good if you turn your neck the other way. But what you have to imagine is what the musculature is doing on the side that you're turned to and the side that is allowing you to turn. So one side is really getting shortened and tight, and one side has to elongate to allow this movement to happen. So you're in that position. Is it a good idea for you to stand in this position for however many hours you may be sleeping at night? No. So let's try to fix that. So that's the first problem with stomach sleeping is the neck, and it's a huge problem. So we're going to travel down the spine. If you have any low back issues, if you have what is called an anteriorly rotated pelvis, or you have hyperextension, so this curve is really, really defined, over-defined. In this position, it's going to feel comfortable because you're playing into the dysfunctional pattern that you have. So if you try to back sleep and you have this as a pattern, or you have neck issues or you have back issues, and that's the natural way your body wants to be, this is going to feel more comfortable, but for a reason, because this is playing into your compensation patterns. So in this position, you are accentuating the problem that is already there. So moving down the spine, so we have my model here in some leggings that are not anatomically correct, but for my visual learners, hopefully it'll give you a better idea of what you're doing with your body over the long hours of the night that you're sleeping, so you can make some good changes to either help those things you're doing already, whether it be chiropractic, PT, massage, just more body awareness. These things will be helped by sleeping better. If you're doing none of those things and you're just starting here, this is also a good place to start, just being aware of where your body is in space as you sleep through the night. So we're looking at the pelvis with SI joint issues, rotational issues of the pelvis. What you do as you sleep is going to, again, either help or hinder the structure and the anatomy of the body. So as we travel down, most people that sleep on their stomach are going to roll their legs in. So you're going to have your knee being pushed in towards your body. And what I have depicted here is the sciatic nerve And any of you that have ever had chronic low back issues or sciatic nerve pain are very familiar with that sciatic nerve. It comes out of the lumbar spine and travels all the way down the leg. So what you do with your leg is going to either irritate that sciatic nerve via the muscle, via the tissue. So we want to keep this as straight as possible. Moving down the leg before we get into more dysfunctional patterning with the stomach sleeping, if you look at the feet, if you have issues with plantar fasciitis, if you have ankle issues, again, knee issues, when you are sleeping, it's as if you're wearing heels all night. So you are flexed, your plantar flexed down here at your feet. That is not a good thing. Would it be a good thing to stand in heels for 6 to 7, 8 hours if you're getting 8 hours of sleep? No. So again, what you're doing here at night for all of that long time, you're creating a habit, you're creating a pattern. The tissue learns that pattern, the musculature learns that pattern, and it's either going to be helpful or it's going to be a hindrance to your overall anatomical function. So obviously we already talked about the back, the neck being a huge issue. Most people probably don't keep both feet down like this. Most people are going to take one leg and they're going to bend, let's leave this one straight. And they're going to bend that leg up. Now this is not comfortable for her, I can tell. If you want to put your arms down or change those any way you can. So most people are going to have one leg that they prefer to bring up and out. So the muscles depicted here are the piriformis, the hamstring, and the gastrocnemius. These muscles cross each other. They cross the knee, the tendons cross each other. So if you have knee issues, the musculature has to shorten up to allow this to happen, this motion. So you're literally going to start losing length in this muscle. The tissue that surrounds all of these muscles is going to get tighter and shorter, and it's going to cause more tension in your knee joint. The piriformis muscle does external hip rotation. So if we're out straight and you turn your leg out that way, that's external hip rotation. So if you have, again, any issues of the SI joint, any issues in the sciatic nerve, that bend and lift of the leg shortens up that piriformis muscle and other external hip rotators of the hip, causing that muscle to memorize a shortened pattern. Because your muscles, to maintain stability in any joint, should have a certain amount of tonus. When we teach them and train them to stay in a shortened position, that's the position they learn. So stomach sleeping is in many ways bad, but a big part is the neck, and the second big part, which is harmful to your body, is what's going on with the hip and the knee. And it's because of what these muscles have to do in shortening to allow this pattern to continue. So again, as we look at the stomach sleeping, I think you can tell from this depiction, it's just not a good thing. So we're going to go into our next habit of sleeping and show you how we can correct that. So I do want to offer a modification for stomach sleeping. If you're at the end of your rope, you're trying to train yourself to sleep better, or you just have a bad day and the stomach sleeping is where it's at, I get it. So I want to give you a simple modification, 2 modifications that will help you a little better align the body and just be better for you overall. So what you're going to do is incorporate a couple of pillows. So to sleep better, you're going to have to invest in a few extra pillows. The first thing you want to do is support the legs. So we're going to bring these legs up. Pillow goes right up to the knee. So now that flexion is out, the feet are nice and relaxed. We can keep our legs more at shoulder width apart, femur coming out of the hip, legs staying straight. So all of our musculature is right in line with the body. And you're more likely to stay in that shoulder width apart and not kick that leg out. So the first thing would be to support the lower leg. The next thing would be to get an older or more flat pillow. And especially you need to think of your size. So the model here is very small girth. So she needs a very small pillow, maybe even tinier than this. What I'm going to have you do, Taylor, is raise that for me at your belly. And you're going to put a pillow under your belly And what that's going to do, you can see that completely took out. If you have that really accentuated curve in the low back, that's going to raise that up a little bit. If you have a lot of breast tissue, this is also going to be more comfortable there, because then you'll have more space. Your back will be better aligned. You also want to watch what you're doing with your arms. A lot of people have a habit of bringing one arm way up under the pillow if they turn to that side of the body. And that's really compressing all of the nerve bundles that run through into the arm and hand, contributing to carpal tunnel. So definitely take that out and try as best you can to find a position that's a little more open for the shoulders. So your two modifications for stomach sleeping would be to find a small pillow to put under the rib cage to open that up, and a pillow to go under the lower leg to keep the legs nice and straight. So that would be a modification if you just can't get there right now, to give a little bit more alignment to the body in stomach sleeping. All right, guys, the next sleeping pattern we're going to break down is side sleeping. And side sleeping is actually second best. We'll get to the best in just a moment. Side sleeping is second best, and it can be beneficial and helpful for you if you do it correctly. Now we're going to start out with what most people do. So really bring your legs up further into that fetal position and curve even more. So most people that side sleep love the fetal position, and they may even bring it in tighter than this. So if you can just put yourself back in your mind in the office at your desk, this is what that looks like. So we know it's not healthy to sit at our desk for so long with the forward head posture, the forward shoulders, arms tucked in. So sleeping in this position at night for many, many hours certainly is not helping. It's actually hindering and making the problems that you have worse. So how can we sleep on our side and it be okay? So let's look through a couple things. So first of all, again, as we talked about on the stomach sleeping, with this arm under the pillow, people usually have that up. A lot of people sleep with their arm up here. So again, the nerve bundle coming behind the clavicle, you're compressing that all night. So if you have carpal tunnel, if you have any elbow issues, if you have any neck issues, you're just cranking on those nerves all night long. So you've got to get that arm down. A good thing to do if you do have carpal tunnel or any arm issues, open your hand up. Make a nice wide fingers under that pillow, under your head, and just keep everything in good alignment under that pillow. So what we want to do is try to open the body and give it as much space as possible in this position. So she is already kind of at 90 degrees, but what we want to do here is if I came behind you and put a yardstick from your head to your sacrum, I would want as much of that yardstick to touch your body as possible. So that would mean you would not be in that fetal position. You'd be a little more straight. This isn't going to feel comfortable if you have a pattern of anterior flexion like we talked about in the banker's back video. So how can we make it a little more comfortable? Again, we're going to invest in those pillows. And we're going to take you can do a large body pillow, a large body pillow or 2 king-size pillows. And again, the size of your pillow, the thickness of it, the density of your pillow will be determined by how big you are. She's thin, smaller pillows will work. If you have more girth, you need a bigger pillow or a couple pillows. So here also, if we had a large body pillow, this would work well even better. So she is going to have a pillow to hug. So now what we have done is stack the shoulder, stack the hip, and open up the torso. So this posture is much more healthy for the nerves, for the musculature, for each joint, for the neck, because we go back to that proper posture we talked about in the beginning, ear over the shoulder, over the hip, and everything in between nice and straight. So this is going to be your best way to side sleep. An addition that I would add, if you have more back issues, is to again take that smaller, thinner pillow, and as best you can lift up for me, and slide that under the torso, and that will help elevate the rib cage and may also help that lower shoulder, because that's one of the problems with side sleeping is that shoulder that's on the bed is getting cranked into your neck. So if you put a pillow under the rib cage, you have kind of a little valley between the pillow you're using for your head and that pillow under your rib cage for that shoulder and that joint not to be so compressed. With the pillow for your head, so with the pillow for your head when you're side sleeping, just relax for me. You don't want the pillow to be so flat that your head falls down, so now you're not in proper alignment with the back, and you don't want it to be so thick that it raises it up. Again, you're not in proper alignment with the back. So whatever pillow you choose, and it's different for everyone, there is no magic pillow, you want the best to be where your head is in line with your spine. So that's going to be how you make your pillow choice. A lot of people use a really thick pillow and their head is cranked up like this all night. So again, looking at that side that is flexed to the left, these muscles are all tight. The muscles on the right of the neck are all elongated, becoming weaker, if it's a habit for you. So that's what we want to do with the pillow choice. So one last thing about side sleeping, laying on your left side is better. It facilitates better lymph flow. So you do want to sleep on your left side if possible. And for blood flow, you want to make sure there's never a hanging joint. So if she had a smaller pillow, and you think, okay, this hip is stacked here, but now you have the leg hanging down, the foot hanging down. You want to make sure each joint is supported and as in a line as possible. So make sure there's no hanging joints, everything's supported. Sacrum, back, and neck are in as straight a line as possible. And that's how you can best sleep on your side. So let's move to the number one best way to sleep. All right, guys, so now we're back to our number one best way to sleep. And most people are going to say there is no way I'm ever going to sleep on my back because it is not going to be comfortable. Promise you I can get you there. If you will do some of the other videos that we have for stabilization, the ball routine, some other different things to activate the muscles that hold you back and down, open up the muscles that you're really flexing and closing in all day long. You can get there, I promise you, because your body wants to be in good alignment and in proper alignment. This is your best sleeping pattern. Now, it can be done incorrectly because, again, we talked earlier about how bringing that leg up and out, if you remember the back of the body, the sacrum, the SI joint, the lumbar spine, turning that piriformis muscle into external rotation. Doing this with your body as a habit is not good. So if you sleep on your back, but you do this, you are continuing to improperly use the hip joint and improperly train the musculature, the fascia, everything in the leg around the knee. It's making it all tight, it's making it torque, it's making you contribute to the pigeon-toed walking. If you have any hip joint issues, if you have SI joint issues, lumbar spine issues, this is making it worse. You have to stop. It's not going to help you if you keep getting chiropractic, massage, PT, whatever. If you have this habit, you are undoing all of that good care. So if you sleep on your back, awesome. We have to get rid of this external rotation and flexion of the leg. So we're going to bring that leg back out straight, because remember, our good posture is ear over the shoulder, over the hip, knee, and ankle. So that's where we're going to be. But mistakes in back sleeping. Number one mistake that I often hear of, because if we have a neck issue and we have the anterior posture, the comfort side of it is to play into that posture. So the number one thing that I see wrong with this possibility is stacking up a bunch of pillows and having that neck and anterior flexion all night. So you're sleeping in this position that's closing up the neck, all of those nerves that come out of the cervical spine. This is just not good. So if your pillows are so thick, it's bringing your head forward of the spine. This is contributing to that banker's back, to the cervical issues that you have. It's over lengthening the posterior, shortening the anterior. So if your pillows are stacked up like this, bad news, you have to correct it. And if you say, I can't sleep flat on the bed or with just a small pillow, there's a reason why, so we need to figure that out. But this is going to be just some general rule of thumb that will help you sleep in a better posture on the back. So when you have a pillow, I get the question all the time, what's the best pillow? It's different for everyone. It's different depending on what kind of mattress you have. If you have the ones that are conforming to your body, you may not even need a pillow. I don't sleep with a pillow, but it's different for everybody. So this pillow actually is still a little bit too thick for her, but you want a pillow that's going to allow your body to have your head and ears as in line with the spine as possible. So that's with the pillow. With the arms, if you have forward shoulder with that forward posture, you don't want to put your arms down like this, because if the arms are down, it's pulling the head of the humerus with it. So the better thing to do is to put your arms up on your body somewhere. It could be your stomach, it could be lower down on your pelvis, but bringing those arms up a little bit will help roll that shoulder back and down and provide more opening for the front of the neck. So that's the arms. With the legs, we mentioned that we don't want the legs up and out. Again, we want to find some support. So lift your legs for me. So get some support under your legs. We want them shoulder width apart. So one of the other problems that we have in back sleeping, oftentimes we have a habit of crossing our legs at the ankle. We don't want to take our joints and bones out of alignment for any reason. If you have your legs crossed at the ankle, we're playing into that pattern of external rotation. That piriformis muscle that we talked about earlier in stomach sleeping is being pulled out. We don't want that. So we don't want the ankles crossed. We want space for the pelvis. So your pelvic floor muscles are a whole nother ballgame to talk about in another segment, but if you are clenching and closing in, that's also a lot of psychosomatic issues, a lot of compensating with the pelvic floor muscles, but closure of this structure here is not good for you, and it's better to have space. Opening the pelvic floor muscles creates opening and space for the rest of the body. So our goal is to be shoulder width apart, toes to the ceiling. We do not, again, want any legs coming out this way. So with a pillow, a nice big thick pillow, you are taking the pressure and pull out of the hamstring. So it's going to be a little more comfortable for the low back. So legs are straight coming out of the pelvis. Arms are somewhere on the belly or the chest. Shoulders are rolled back. Head is in line with the spine as best as possible, not up too far. And this is going to be your best sleeping pattern because it's taking all of your bones, putting them in the correct position, giving you better blood flow, less nerve impingement via muscle or tissue or bone. This is your best bet. And you can get here, I promise you. So if you want to help yourself, if you have chronic pain, if you have issues you're dealing with, old injuries, issues you're dealing with every day, when you sleep at night, the many hours that you're there, if you can put your body in a better position anatomically, you're going to help yourself get better quicker. If you don't watch how you're sleeping, if you're not aware of what your body is doing in space, you are only going to prolong your healing and contribute to dysfunctional patterning, which leads to pain. So please take this advice. Start to learn to sleep on your back. It can be done. Everyone's body is different. It will take different amounts of time for each person, but I hope these few cues will help you to find better alignment with your body and eventually less pain. Thank you for watching today, and I want to thank my wonderful model. Here she's almost asleep. This is my daughter, Taylor. I just want to thank her for helping me today. So I hope this has been helpful for you. Thank you so much, and see you at the next video.